Good morning, everybody. Sorry. I'm losing my voice. You won't have to listen to this tortured thing for very long because Elise stole my thunder a bit. So you have here my fabulous panel. Each of them has a really compelling and unique perspective on the importance of innovation and, frankly, the challenge of innovation in a regulated environment. I don't have to tell anyone in this room the importance of innovation. Obviously, this is what we're all here about. But I think it's ranging from product standards or positive lists all the way to monographs in places like Canada, and then, of course, in the US, it's a particularly, I almost said egregious example of pre-market authorization and the challenges that it presents in terms of innovating products. So each of them has a unique perspective here to talk about that today. But I think what we're trying to get to is essentially figure out not only how do we grow our business, but also how do we make a better consumer experience. But in certain circumstances, it's actually, I would say, in the governance benefit to support innovation. If you're talking about age verification technology or product changes, could actually be an improved health experience for the consumer as well. Sorry. In any event. Oh, shoot. I don't have my clicker. It's right there. Could you advance to the next slide? Thank you, Chris Greer. I'm knocking it out of the park today. All right, here we go. So obviously, one thing that we all have in common on this stage, beyond being women, as Elise pointed out, is that we're all Americans that have been working in the FDA-regulated space. So we'll start out today with Laura Lee talking about this environment, but I just wanted to set the stage a little bit. As you can see, FDA has been making some progress in terms of slogging through the pre-market tobacco product applications, but a lot of people are stuck in the queue at this point. So any product innovations, any changes, any improvements that have been made are still just hanging out there and waiting. And companies can't move forward with these products without risking regulatory action. And of course, that means that in a company like BAT, for example, the version of views in the United States is several generations behind where it is in the rest of the world because we can't make any changes to these products. This is a pretty compelling. So if you file a PMTA, this is where you are in the queue at this point. And it's not, despite the metrics that have been published, despite the information that's been provided by the agency, it's not entirely clear when things will move, when they'll take action, what their priorities are. And I suspect Laura Lee has some pretty colorful things to say about this.
Yeah, I mean, it's obviously kind of bleak when you look at the numbers of what's been submitted versus what's been authorized. And so I'm not going to talk about product innovation. I want to talk about process innovation a little bit today. So I would say that we've got three big opportunities from a process innovation standpoint to focus on as an industry right now. The first is what we submit. The second is how we engage with the industry, how we engage with the agency. And then the third is how we as an industry should be collaborating, I think, in some new, different ways in order to help the regulator out. So, I mean, PMI kind of famously set the bar with the original IQOS application, 2.3 million pages. I think we can all agree we should not be having to submit that many pages in order to get a product authorized. I will say that given the novelty of heat-not-burn technology and the infancy of the agency, as it likes to say it's still in, I don't know that the product could have been authorized with less at that point in time. But I will tell you that we requested a postmortem with the agency after the submission and asked for feedback. And they also don't want to get 2.3 million pages if we can help it. I think there's been a lot of learnings on both sides. Obviously, they've received 27 million applications since that time. And so a lot has been learned. Many of us are starting to focus more on things like how we leverage our master files as a way to promote innovation, not only for future products, but also with the agency, right, as a way to sort of cut down on the volume of paperwork that we're submitting. And I think another opportunity that we have is to really think about the end user of our submission, which is your scientific reviewer. So making sure that the applications are tailored with that audience in mind and making it as crisp and clear as possible in order to help them understand the application and the product. I will say too, I think we've had I think many of us have had challenges with industry engagement in the last couple of years. I know for a time there was just none. I mean, it doesn't matter how many emails you sent, how many calls you made, there just wasn't any information coming back from the FDA. That has improved in the last 6 months, and so I have hope that that will continue. But the agency has called for us to have open discussions with them about our priorities, right? If you've got multiple applications sitting there in the queue, it's worth it to reach out to them and say, hi, here's what our priorities are. Can you move a little bit faster on these things? And I will say, too, we've had some success in negotiating with the agency on post-market requirements, which can be pretty voluminous as well. And I think what I've found to be the most effective, I mean, it's a data-driven agency, as they love to say, giving them data has really helped sort of shift, I think, their thinking on some things and our approach as well. And then the third thing is, I think, how we can work together as an industry a little bit better. It's going to require us putting aside distrust of each other, and it's going to require us to put aside a desire to leverage the regulatory environment to get competitive advantage. So as an example of what I mean here, I think literature reviews are an obvious and very low-hanging fruit. The agency does not need to get 27 million different versions of what amounts to the same information over and over and over again. And so several companies have worked together in this space to have a consortium-based approach where there's a centralized literature review, it lives in a TPMF owned by a third party, everybody's pointing at the same data. So I'm aware of that happening in at least one of the categories. I think we've got opportunities to do it across several others. At TMA this year, we were afforded the opportunity to have breakfast with the regulator. And during that conversation, they helpfully suggested that we should come together as an industry and deliver a set of change management guidelines to the agency that we can all agree with. Because, as Valerie said, getting a product into the market is a challenge, but dealing with the myriad of changes that have to happen, whether because of supply chain issues, upscaling your manufacturing, there's a whole host of reasons that products need to change. We're just sort of stuck right now. So if we can work together to help the agency with the change management, I think we would all benefit from it. Now, I will acknowledge, as I say that, that's going to be a slow process, right? I mean, we gave the agency a set of recommendations for TPMPs over a decade ago, and finally did get that regulation, and it is largely what the industry put forth at that time. Hope it doesn't take a decade, but I would like to put out a call to the room that we should be gathering, using forums like this, getting together a half day early to have meaningful conversations and try to put something tangible together for the agency's use. And that's it. Those are my 3 things.
Thank you. So Jessica Zadinak, lady. Anyway, you have a perspective from outside of the companies, working with them, as well as an international perspective, which could make it a little more relevant to folks in the room who possibly don't care about FDA.
And thank you so much. So I think, from our perspective, it really is a balance between public health and consumer choice. And we typically look at this from a global perspective. So both of those are global issues. And it should be viewed, this innovation, our industry, the products that you guys and manufacturers are putting on the market, should be viewed in this lens of public health and consumer choice. Sometimes those 2 issues can be viewed on different sides of a coin. And so I'm going to actually go through a few slides and just give you some examples of the different countries and the regulatory frameworks, what it takes to get a product on the market. And I think definitely have spent 10 years focused primarily in the US market, but definitely in the past year expanded pretty significantly in the international space. And it's very interesting because we talk with people internationally and they really aren't coming at innovation and their products from a public health perspective per se, or sometimes, and it's more about consumer choice. because they want to innovate and put products on the market that consumers want at that time. And so then it's balancing, though, that with the public health and the standards that we should all be following to test and get those products on the market. And so if we look at some of these regulatory frameworks, for example, excuse me, and we look at United States and FDA and exactly what it takes to put an application in with the agency to potentially receive authorization, you can see that list is very long. And I apologize, there's a little bit of overlap there on the slide below. And I'm going to go through in a few minutes about the time frame that it takes to do this, right? And then you compare that with, for example, the UK and MHRA, pretty significant testing that they're looking for. However, it's a box check, right? So it's checking the box that you've conducted these studies, but not necessarily needing to put in the data to support it. In India, and it's nicotine and tar content testing. In the EU, again, there is some scientific testing that is required there. But again, you look at that and compare it to the United States. And again, it's APPH, right? So appropriate for protection of public health is the focus. And so that's why I kind of think about it as a dichotomy of public health versus consumer choice, because in the one bucket, it really is about the APPH standard. Not saying it's not in other countries, but the focus, again, is more on that consumer choice. And so I'm actually going to skip that slide and go into this, because I think this is where then it starts to break down, particularly in the US market. So our focus is on smokers, right, and getting smokers to switch off of combustible cigarettes. Well, it all begins then in the product development pipeline and your process. That is where innovation begins. It's one of my most favorite things to do is the product development process. So rapid, continuous feedback is critical as you're innovating and developing your product. And as a psychologist, the focus, for myself and our team is, what do consumers currently have as an option? What are their needs? What are their wants? Where is the gap? But all of that then falls under a variety of different factors that's going to drive the answer to that question. Whether it's the cost threshold of the product, and so we talk about age gating. Well, that inherently means the cost of that product is going to go up. So what happens to the populations that honestly don't have that money? They're going to continue smoking. The access to it, so family factors, whether or not a smoker has kids at home, is taking care of sick parents. Their current willingness to put down their cigarettes. Self-efficacy, which means, do I think I have the ability to stop smoking? Do I think I have the ability to use this very technical product? If they believe that they don't use it. It is a big barrier. We look at personality factors, so openness, conscientiousness, extroversion, agreeableness, and other psychological factors, and their current health, work environment, public information, misperceptions of risk. So that is honestly, some of that even changes throughout the day for our consumers. And so when we look at how then that impacts what it takes to get to market. So the US PMTA pathway, that up to 1 year is basically what I just talked about. What are the current unmet needs? What are their wants? What are those psychological, personal factors? And you're going to meet with consumers. You're going to find that out. You're going to make sure your idea, your concept is viable. You're going to redo it. You're going to reformulate it. You're going to do a bunch of stuff, and that could take a year. Then you're going to go hopefully meet with the FDA, pre-submission meetings, and you're going to talk about that product. Then you're going to conduct the scientific research that's required to submit your application, which is probably 2 years. And right now, in the past several years, it's been then 2 to 4 years before we even know, or companies even know whether the product, right, is going to be authorized. And so this is going to have huge implications to the smoker. How can you innovate and put innovative products on the market that consumers want, to your point, Laura Lee, that literally they wanted 6 years ago, right? And so I think it's a really big issue. Now, let's compare the innovation in an international market, about 3 to 6 months. And so you find a gap in the market, you find your smokers' wants, their needs, is it viable? You may or may not do pilot testing, you may or may not revise the product. You do your 1 to 2 months of testing and you get authorization. Do we think the products in that scenario are going to be more or less relevant to the consumer than the US PMTA market? Of course they're going to be more relevant because it's the time at which you've tested with them, you know they want it, and I think it's going to lead to more successful switching. And so I'll stop at the last point is those current life factors that I talked about that should be the focus in that product development scenario will be relevant in 3 to 6 months, but they are no longer relevant when it's 4 to 6 years to get a product on the market. And I think it's a fundamental issue. And if we're really focused on smokers and giving them products that will help them put down one of the most deadly products in the world, we have to make sure we're doing it. And companies have to make sure it's on the market in a relatively short period of time. And I know it's not on you guys; it's on the manufacturers. It's on the regulatory environment.
Excellent.
I'll pass it.
Thank you, Jess.
Mm-hmm.
So
This
Lillian has kindly agreed, as mentioned previously, she previously worked at FDA for several years, so she has agreed to give us a little behind-the-curtain perspective as well as you're now working to support the industry as well, how that's changed in terms of your perspective.
Thank you, Valerie. I don't want to repeat many of the important comments and thoughtful comments of my expert of panelists have expressed, but I will touch on it based on 22 years in the federal government, 14 of which at FDA. And I will say that I had the pleasure and the privilege of joining CTP in a pivotal time in the agency. It was a year before the deeming rule. And so in 2015, at that time, we were regulating the traditionally regulated products, the cigarettes, smokeless, roll your own, and cigarette tobacco. For me, it was an exciting time in which the opportunity to guide an industry, a new industry that had not been regulated in this capacity, on this federal regulation capacity, guide the industry, ascertain, but also collaborate with the industry and have a better understanding of what it is they anticipate from the FDA, but also we can express and I say we because at the time I was at FDA, it's that we can help them understand the expectations and the backgrounds of which the regulatory landscape that they were entering. What are the requirements in which they needed now to comply with in those specific timeframes? And I will say that it was interesting because we were expanding our jurisdiction to include products that were innovative at that time and continuing to innovate. And then it was a pause because they could no longer innovate those products because of the regulatory landscape in which they were entering. So your products kind of stood still as of August 8th, 2016, because of the date that the deeming rule was issued. And I will say, as a regulator, prior to coming to CTP, I was also at another center within the agency. And as a regulator, I believe in this, and I was actually taught when I came on board to FDA that the primary goal of a regulator is to achieve voluntary compliance whenever possible. And in order to do that, there is a balance that a regulator must provide this industry. And the balance is guide that industry as best you can so that they know what to expect from you, that they know where the guardrails are, where the framework lands, what they should do and what they shouldn't do to be compliant versus non-compliant. Collaboration with industry. Have that dialogue with industry so that they understand that it's an open door, that it shouldn't be a black hole where information goes in and information does not come back out. Have that collaborative effort and present that to the industry as an open door policy. I think also as a regulator, I come from the Office of Compliance and Enforcement within CTP. I believe enforcement is necessary for a fair, compliant, and responsible marketplace. Whenever you cannot get voluntary compliance, there is a framework in which enforcement is needed. And I believe in those three pathways as far as achieving that balance as a regulator. And I will say that in 2016, 2017, that was the tone originally, was to let's look to guide this industry. Let's learn from them. What is it that's happening that we don't know? Because we have not regulated these products. There are new products, and it's not just one or two categories, which we knew the majority were ends, but there were also other types of dissolvables, lozenges, other products that we'd not seen. So let's understand those products before we just jump in and give you, this is the regulatory framework in which you need to comply, stop innovation, and put in your submission. So at that time, I believe that there was that balance. I think things have shifted along the ways, but that was the balance that was needed, and I still believe in that balance. I do believe in regulations, and because it helps with standardizing and providing a fair and responsible marketplace. I'll say that I won't jump into the pathways, but there are three pathways to market. It's as Jessica pointed out, there's the pre-market tobacco product application pathway. And that's the pathway many of these new products are entering because they weren't on the market as of February 15, 2007. And that's the date in which those products that were on the market were considered pre-existing, or as previously known as grandfathered products. And many of those are not those new products of ends and other categories. And so pretty much the pathway that you would come in is through this pre-market tobacco application pathway. It is a pre-market pathway, meaning that you do the work on the front end, you submit it to the agency as it's intended, you do it on the front end and you submit it to the agency, they review, make a decision, and then you come to market. However, after deeming, when deeming was published, these products were already on the market. And so applying the PMTA to products that were already on the market was a challenge in itself. Because now you're asking the industry to produce scientific evidence to this regulatory framework so that you can make a decision, as the agency can make a decision on the scientific data. However, this is also a learning experience, and there wasn't a learning curve for industry. It was an expectation that you read and you understand, and then you provide that information. I think this is where the challenge lies, is that there was opportunity through those 4 years to provide more guidance, to provide a regulatory framework, a structure, give information, specific information to the industry so that they can provide robust scientific evidence to help the agency streamline these review process. But lo and behold, that's where we are today. And so there are challenges within the FDA marketplace, as you all are pretty much aware. The deadline for submitting applications that were for products that were on the market as of August 8, 2016, was September 9, 2020. So the agency received 27 million products. At that time, it was a court order deadline based on a lawsuit when the agency originally provided guidance on a staggered approach of receiving applications. There was a lawsuit, and where the court order was that the agency had to expedite the deadline and require that these products come in with an application. In that same court order, the courts provided, or they ordered the agency to review all of the applications in a 1-year time period. So 27 million products in 1 year, make a decision, and then if those products have not been granted marketing authorization, then they come off the market. I don't know about you all, but 27 million products in 1 year, I don't know who can do that, especially with the amount of, as Laura Lee pointed out, the amount of evidence within that application, the investigations, as well as the health risk, and so on and so forth. So this is a challenge already that was presented to the agency. I think what complicated moving forward, or what complicated, sorry, I'm just going to skip over that. What complicated that process was that there was a decision by the agency as the one-year approach came about, the one-year date came about, where there was a decision to evaluate products based on a standard that was not clearly provided to the industry as a requirement. And so that led to hundreds of marketing denial orders, which eventually were challenged in the legal capacity. All of this is happening in this 4 to 5, 6 year now time period since steaming. All of this is happening while the illegal marketplace continues to grow. The illegal marketplace, where there are products on the market that have bypassed the regulatory marketplace or bypassed the regulatory pathway, have not submitted an application, don't intend to submit an application. Those that had submitted applications that were not of quality received negative actions, but disregarded those orders and continue to put those products on the market. There are new products that are entering the market each day. Some may say that it's about 60% of the marketplace are illegal products, illegal and illicit products. I will also say that where that 60% is coming from, many have said, are predominantly ends products. But I do see that this is also leading into other product categories similar to, such as nicotine pouches. So what do we do with all of this? Well, I believe that there are, even though there are so many challenges, I still believe that there is room for optimism in this regulatory process. I think there is room for change, as Laura Lee pointed out. There's room for change, there's room for growth on the FDA side as well as the industry side. What can be done to move and to promote innovation? And as my expert panelists have already mentioned, there is opportunity, but it requires collaboration. It requires an understanding of what is expected and where there is flexibility and growth in that specific framework. One example that I'll point out is global standards and recognizing global standards. The agency over the past couple years have issued guidances as well as final rules where they reference global standards, ISO, Caresta, ICH, even UL standards, where they reference standards that are globally recognized, and there's opportunity for those standards to be utilized in this regulatory process, specifically to streamline this process. If those standards are being used and being submitted within the application, if you have a certification for UL standard, UL 8139 or 8165, the agency could recognize that as that certification as, okay, we know what that brings, that certification that they've met the battery standards and the specifications, that we don't need to continually review that process so thoroughly. That's just one example where I think innovation can prosper. I think the second innovation is, the second thing that we've talked about, I think it's important that industry drive this narrative. Leverage the framework, the regulatory framework that the agencies provided. It's for you as an industry to understand, to work within, but also to push the FDA a bit on the expectations within that regulatory framework. Where are the guardrails and where is their flexibility? But that only comes with collaboration, and that only comes with open doors. And so I would say have those conversations, continue to engage with the agency, continue to ask the tough questions, so that, and I'll say that as a regulator, as a former regulator, I expected to be challenged every time that I had a conversation. I expected to be questioned on the reasoning for making whatever decision that I made. And so FDA should not feel that they shouldn't be challenged with it. It's a normal process with any regulatory agency that whenever you put out guidance, it's questions, it's understanding, it's the opportunity to collaborate, and it's also a perspective when your industry speaks to FDA, it's also giving your perspective on where there are areas for improvement and also collaboration. So I'll stop there because I know we have an engaging conversation after, and we still have one more panelist.
Excellent. Thank you, Lillian.
I feel like I'm about to be a downer. Is my mic not on?
No, I think it's on. Get you closer to your mouth, maybe a little bit.
Hello? I mean, I can scream really loud. Okay, I think it's on now. Okay. Well, Well, I hate to be the downer on this one, and I don't want to keep repeating, but first, thank you, Valerie, and also thank you, Elise, with an awesome panel of all ladies. It's pretty awesome. I'm just going to go right into it. The PMTA, it's archaic, outdated, unresponsive, and clearly isn't a viable pathway. Since 2015, the FDA has issued only 56 orders for products using the PMTA pathway. To put it in perspective, using the SE pathway or the other ones that you can go through, since 2012, 16,829 products have been able to be sold. We'll break it down even further on that one. In 2023, the FDA issued 994 tobacco product orders, including 137 for cigars and 662 for combustible cigarettes. There was not a single order issued for e-cigarettes, but they did do 3 heated tobacco products using the PMTA pathway. So I just kind of find it this really weird that all of our products have to go through a really intense regulatory process to bring a safer product to market, and especially when the FDA is saying that they're trying to work on informing people about the harms of nicotine and the tobacco harm reduction. But to be fair, it's not really the FDA. Our policies are tied to the administration. So it's not really science that's backing up our tobacco products regulatory schemes. It's whether it's Donald Trump or Kamala or Joe Biden or George W. being president. It's worse, all of our government officials, the presidents and well-meaning city council members have always pushed reactionary policies, which just aren't really good. They end up leading to de facto bans. They just don't take in consideration to the consumer what's actually going on in the market. It was former President Donald Trump who banned flavored pods back in 2020 in reaction to Juul and then the youth vaping epidemic. And this ban did directly lead to this proliferation of disposable vapor products that we have in the United States. But I mean, this increase in these illegal products are directly correlated to significant decreases in smoking and also in cigarette sales, and that's coming from some of the largest tobacco companies themselves. Recent quarterly reports indicated that they lost a 10% reduction in cigarette sales from 2 of the major manufacturers. And they're indicating that it is these products. But this is, I think the biggest thing, there's a regulatory catch-22 going on in America. It's unfair for these companies to have spent billions of dollars in this process to be losing out not only to they have approved e-cigarette products, but they're losing them out to people who didn't even do a PMTA. But now they're also losing cigarette sales. But it's kind of just the way that the FDA process is not designed for this. It's the PMTA pathway. It's just not a very viable process. It doesn't, take in consideration what the actual adults want. Dr. Constantinos Farsalinos did an amazing consumer survey back in 2018 of nearly 70,000 adult American vapers, and over 80% of them were vaping fruit and dessert flavors, respectively, which is pretty impressive. And again, we still don't have any fruit-flavored e-cigarette product on the market. I actually helped people inundate the FDA with not a real PMTA, but we were on their radar, and with e-liquid companies that had been on selling e-liquid juice since before the deeming regulations went in there, and I know that their flavors were important. I actually helped them do their consumer surveys. Their average age of their customers were in their 50s, and yes, they like pink bubble gum and cherry. And I use a flavor device that's completely illegal. And I have no problem with it. But I will sit here and say there has been really some positive, despite whatever the FDA is doing, there has been some positive stuff. In 2023, 7.7% of youth were vaping, and so were 7.7% of adults. And that's actually really great that we finally have the same number of adults and kids vaping. So what it was is 2.13 million youth who were vaping last year compared to 20 million adults who were vaping, current vapors. So for every 1 kid that was vaping, you had more than 9 adults that were vaping, and all probably using mostly illegal products. The 34 products isn't going to help all 20 million of those people. But even better, cigarette smoking is down. In fact, 12.1% of adults were using combustible cigarettes last year. It's a 13% decrease from 2022, when 14% of them. So we're not seeing an increase, and especially smoking is pretty much non-existent among 18 to 24-year-olds. I was looking at some states. I mean, you're looking at 5% or less. There are more older people smoking than what there are, young people. And youth vaping has declined significantly. So I don't know why the FDA is still harping on kids vaping. It actually went from 20% of youth using e-cigarettes regularly in 2019 to 5.9% this year. It's a 70.5% reduction. We went from 1 in 5 kids vaping to 1 in 20. 1 in 20. And I think it's just awesome. So again, I don't have much to add because everybody's done a really good part, and I do a lot of stuff coming from the outside, but I just sit here and say the FDA is not really, I wouldn't recommend their regulations for the rest of the world. I think Europe does it good with the notifications stuff, and that you can bring innovation to the market without having to go do a whole new PMTA. So don't do the PMTA, guys. Okay, that's just my major recommendation, and and adults like flavors too.
Excellent.
Thank you.
Thank you, Lindsay. So this is probably a question for Lillian or Laura Lee. Basically, I feel like I have to play the devil's advocate for FDA's sake. They're dealing with a PrEP statute, basically. So they're dealing with certain legal requirements that they have to implement in a certain way. What practically can they be doing? I mean, you've given the example of they're asking for collaboration.
Well, you really handed me that one.
Well,
The language of the statute says that the FDA is supposed to make a decision after 180 days after receipt of the application. So I guess that would be my first ask. Is to follow that part of the statute, because to the extent that they are bound to it, they seem to be able to selectively ignore at least that part of it. And of course, the way they rationalize it is, well, that's a 180-day window for scientific review, but that's not what the statute says. So,
I would say, I agree. And I would say when they don't meet 180 days, however they choose to count the days, when it's whatever review process or whatever review phase it is, it's also challenging them when it's exceeded that time. I think the lengthy timelines in the review process has contributed to the illicit market, and they have to, kind of take responsibility for that because these products are over 8 years old. I go back to the balance that I mentioned earlier that Laura Lee, as well as Jessica had mentioned, being open to changing and the flexibility, understanding you're given this statute where you have the regulatory process and the requirements, but where is their flexibility? And speak to the industry on where there's flexibility with that. That point that you mentioned earlier, the change management, that's also something. These products are over almost a decade now, a decade old. You can't change them in the U.S. However, there's innovation happening in the illicit market. I mean, nowadays you can know your puff count, the battery. You can get whatever you want on those dashboards. And they're innovating. However, responsible manufacturers, such as many of you in the room, you're dealing with a 10-year-old product at this point, and you can't move through the regulatory process. So I think being open to say where's their flexibility within the statute. Change management, understanding that. How can we change the product even though it's under review? Is there opportunity to provide new data on changes to that? Being open to understanding, okay, 180 days, where does that lie? 3+ years to get a product onto the market. I mean, you're looking at those are usual drug approval times, right? 5 to 10 years to get, and that's a full process with investigation of new drug application and phases. So we're approaching that timeline. Where is it that we can collaborate and have a better understanding of, is it 180 days, put the product on the market, and then you let us know when you have challenges, or let us know where you have questions about this process? Because these products are old and they're in other regulatory marketplaces.
I mean, do you have a sense of, not to ask you to give up the dirt about FDA, but are people within the offices that are working on these applications, of course they couldn't have done 27 million of them in 1 year, right? But is there a sense that they understand that they are taking too long, that there are efficiencies that should be realized, and is there a political component to that, right? Outside of the Office of Science, for example, are they getting pressured to either slow walk things or to prioritize on certain things that, from your perspective, could be done better?
I think that there is, I think they recognize that the process is slow. I think as more and more of the industry picks up the phone and calls the center, reach out to the ombudsman and figure out like where my, because I think the other piece here, Valerie, is that you put your application in, and then it's like it's quiet, right? You don't hear anything. Could be years before you understand where you are in that process. That's hindering progress. That's hindering innovation. But if there was an opportunity to say, okay, can I have updates on my process on the application? Where do I stand? That would be better. And if if they had the opportunity to allow their reviewers to do that, that would be a better situation for them, I think, in my opinion. Are there challenges on when you mentioned outside influences? There could be potential outside influences based on different priorities of the center from each different commissioner, HHS, and administration. So it's whatever priority is on the agenda. For example, I worked on TPMP way before I left the agency in hopes that it would come out. I really do think that standard of manufacturing process is important. It's a benchmark, a foundation, and you can grow from there. The industry provided their set of guidelines 2012, and then again in 2017. They have been pretty much in the pipeline to be proposed, through, I think, the last 5 years or so. Wow. And so I think there is delays within the process, and I think there are incredible scientists at CTPs, specifically the Office of Science, and as well as the entire agency has. They have hardworking, dedicated individuals to this regulatory process, but they don't make the final decision, right? So it is. Would they like to provide some information? I think they would, honestly. I think they would. But it would be, it's whatever that administration as well as their leadership is providing them the room to provide that information. That makes sense.
Can I add something to that, actually? Like one of the issues I always found with Center for Tobacco Products is that it's completely funded by user fees. Yeah. And that, it's kind of and none of them are with e-cigarettes or any of the novel, like tobacco harm reduction products. And we saw Brian King a few weeks ago. We need more funding and using that. I think it kind of, again, it gives them a really perverse incentive to not authorize these products because they're not getting any funding for these products. But again, so also this catch-22, it's unfair for companies who are actually paying the user fees to see all the regulatory thing going to all these illegal products. So it's just, they're going to have to fix, I think, in my opinion, that funding schematic because it just doesn't really work out that well.
I think you're correct. 90% of the applications that have come in through the PMTA pathway are for those products that don't pay user fees.
Yeah.
And so I think that's why the agency is asking for additional funds. But I'll be honest and say, in my opinion, user fees on how specifically how other centers have utilized user fees, they come with metrics, they come with goals, exactly. And they're with expectations. Yeah. So signing a check and just submitting user fees without any expectations or guidelines on how it's issued out, I would say I wouldn't recommend.
No. And for the record, I'm not for giving them any money, okay? So.
No more budget. Well, I think you touched on this a little bit, Jessica. I think who's doing a better job of this? Like within the structure in the U.S. that we do have, who else around the globe is doing a better job that you could sort of lift and shift and see how that works there? Yeah,
and I think, Lillian, you mentioned something that I wrote down that I think is important is, I know we all have and see the illegal market growing, but when we go globally to a lot of the trade shows, certainly there are the products from various countries that are just completely ridiculous. That now you can play Tetris on your ends product. You can text message people. That is innovation that is absolutely, in my opinion, not responsible and the exact opposite of what we want to do. But we do, though, see, Lillian, to your point, innovation in the end space that has aspects that consumers really want. We meet with thousands of consumers, and one of the biggest issues with disposables, with all types of various, even e-liquids, and is that they have no idea how far how much liquid they have left. Like, how much is left? I don't know. What does this light mean? What does that light mean? So one of the newest things we're seeing, which we probably all have seen, is the puff count, right? How many, for example, like on average, how many puffs do you have remaining? Battery is low. Those are all aspects that consumers really want to know, because it's a barrier for them to even transition into that kind of product, because they don't know how to use it, or so I think I think the UK is doing really well. I am a little hesitant on what's going to happen here soon, because they're planning several bans on in the end space, but we also know that it is supported in their hospitals. And so we have a colleague who has switched many smokers, as a medical provider. However, in that space, the amount of e-liquid is so small. The nicotine content there is the restriction on that. And so then what you end up seeing is having to, vape 3 disposables a day, and then you see them on the ground. And so now we've got an environmental issue. And so, I think every country has their own issues. China drives a lot of innovation in this space. And the responsible manufacturers from China, I believe we hear all the time, those are the products that consumers really enjoy. I think IQOS could fundamentally also break the market here in the US. I think it was innovative then and still remains, I think, the heat not burn category. I would really, love to see that thrive in the US market.
Laura Lee, you brought up earlier a request from the agency about change management. Excuse me. How realistic do you think that is? I think obviously there are legal impediments to the industry being able to get together too much, right? And then also you're still working within the statutory framework. Do you really get a sense that at the highest levels of FDA they really want this to happen, or are they putting out an olive branch, or is it essentially another exercise? I don't want to say futility, but certainly in a continued year-long cycle.
It felt like an olive branch, I guess, at the time. I'd say I'm not sure how else it's going to happen, right? If we just sit around and wait for them to make changes on their own, I don't know that we're going to see that happen, right? So as bleak as all of this is, I think we have to focus on the things we can control, right? And so this is a meaningful step that we could take as an industry to help the agency evolve in that way. Because we're all going to suffer from this. I mean, to your point about the increase of the technology and the products, if you think about software upgrades, I mean, just use your cell phone as an example, right? It updates all of the time with security patches. Battery life, about 2 years long, I mean, things just, in the technology space, they're gonna have to move a lot faster than what we're seeing out of the FDA right now. And so, rather than just sitting and waiting and hoping for the best, I think we could be doing more to help them evolve.
Yep.
I think when I first started, I was at Reynolds for 12 years, and when the deeming reg came out, there were folks in R&D who were very confused, like, well, this is a safety issue, or, this is the software update, or the manufacturer needs to do this, and they couldn't understand. They said, well, doesn't the agency care about innovation? And frequently I would laugh in response to that question, because it doesn't seem that they did, but ultimately it's not just consumers' options or choices that are being affected, it's actually literal safety issues.
Yeah. Go ahead.
And I think, to your point, Laura Lee, I think that the recent proposed TPMP rule, it lends itself to possibly including change management on the post-market side. I think the goal is to get some products on the post-market side so that they could actually take that framework and create a master file or a manufacturing record where they can document the change control, and the agency would not need to see that as a actual PMTA, but it's something that could be a notification process. It could also be where the agency would be required to inspect these facilities that they can collect during that time. And at that time, they can ask questions, and if there is an opportunity or there are concerns, there is a framework in which they can ask for additional information and say, no, this change, we consider this pretty major, and there may be some safety issues here, and we'd like to see this in another format, not just in an inspection or a prior notification. I think it lends itself. It's just the implementation of these regulations, the PMTA rule, the TPMP, proposed TPMP, or any other guidance. It's how is it going to be implemented, and is it with the context of you're going to collaborate with the industry that you regulate to get voluntary compliance.
If there's any questions from the audience, I think there'll be someone out there with a microphone. But I did want to ask you to follow up on that voluntary compliance. I thought that was intriguing. So I worked in FDA law prior to the Tobacco Control Act, and we always had contacts at CIFSAN and the drug center, people you could reach out to. You know, you wouldn't be WhatsApping them on the weekend, but ultimately you would get a response within a reasonable period of time.
Yeah.
And I think that black hole has been one of the most frustrating aspects of working with this particular agency. So do you feel like there's still a sort of a spirit of we want you to comply voluntarily, or is it there a deliberate shutdown within the Office of Compliance where they just don't want to engage unless it's a specific, enforcement response to something that's gone wrong?
No, I think that there is a shift that's happening. I think they recognize the challenges that we have with enforcement. It's a framework in which FDA follows as a whole on sending a warning letter, issuing further enforcement. But there's also there's a whole division and branch within Office of Compliance that is focused on educating with the webinars, and hopefully that shift would also include public meetings. I've been calling for that a little bit since my departures, having the opportunity to engage with industry, understanding the responsible manufacturers that are up against this illicit marketplace. They have information that they are willing to share with the agency on where the gaps and blind spots may be. So I do think that there is a component of voluntary compliance where you can report potential violations. They'll pick up the phone, and I'll say that during my tenure there were times that I spoke to people that were providing information about, I don't know how to do this process. I want to be compliant. Help me, navigate this. Can you provide this before I become one of those warning letter recipients, or, and I think that's where more needs to be done. But I think there is an opportunity for that. I will say that this is not novel to FDA. Other centers do it all the time, as you pointed out, Valerie. The other centers do it all the time. I was at the Center for Biologics before I came to CTP, and it is a more collaborative approach when addressing industry, having those discussions. It's not immediate going to enforcement when there is a non-compliant actor. It's a phone call, it's a discussion. Help me understand how you got to that place. Why is it that, is there something that we're not understanding about your process or your product, because we believe that it is illegally on the market in those capacities. So I think the same thing needs to apply with CTP, where there is an opportunity where industry can feel comfortable having that dialogue, but the door needs to be open.
If I can expand upon that a little bit. So, I think it all fundamentally comes down to the mindset and the perception of what CTP is as a center versus the other centers that are in the regulatory pathway, such as the medical device, pharmaceuticals. It is the perception in those centers that, because we work in the medical device space as well, that manufacturers are trying to help people, right? Whether it's a newest technology so that somebody can track whatever issue they have, whether it's blood pressure, and so it's a positive perception and mindset and feeling towards those centers because you're helping people. And this industry, I fundamentally believe, is as well, but it's the mindset that CTP is, or that this industry is more negative, and we're actually trying to hurt people. And that, I believe, then fundamentally comes down to the lack of trust, the lack of open door policy, not necessarily wanting to work with industry. And so I would say the best thing that can be done is to try and fundamentally change the way industry is viewed within their center. Yeah.
That's a tall order, unfortunately.
You what?
I said that's a tall order,
Yeah.
unfortunately. So,
Well, I can add to that because I always kind of compare it to automobiles. Could you imagine telling the car companies that they can't make an electric vehicle, they have to stick with diesel? And that's pretty much what it seems like when you're looking at CTP. Again, 16,000 SC pathway products and only 56 that have done the PMTA pathway. It almost is like the regulator is telling the industry, no, you can only do cigarettes. And I mean, I think, look at California. Newsom is actually requiring the automobile manufacturers to do electric vehicles. And then, oh yeah, they just banned, flavors and everything. And it's combustion for your lungs, okay? If we know combustion is bad for the environment, what do you think that does to your lungs? So.
Yes, exactly. I think that is fundamental, though, to change. It would have to be changing the TCA, because that is literally what it did, is it allowed combustible cigarettes to stay on the market. And it's very interesting to me, because APPH, public health, trying to convert smokers, but yet literally the product that's killing them can stay on the market. And
662 last year alone. No e-cigarette, but yeah.
It's rather bleak.
It's very bleak, okay.
Will, did you have any questions? No. Well, I mean, what do you think? Governments generally, but specifically FDA, what could they be? What's the low-hanging fruit to do?
I mean,
better?
honestly, I think we should be I think the states should be treating it like the way that we've looked at cannabis regulation. I don't agree with what the federal government is doing and, reap all the benefits at the state level, in my opinion. But I think, yeah, changing the notification process, changing it from an authorization process to a notification. I mean, again, I helped put people's PMTA paperwork back in 2020, and it was amazing just seeing some of the same recipes. And it's the fact that, they're all doing individual applications, even though they're the same products. They could make it a lot more easier, and also so it's responsive. I can't wait for IQOS to come into the States, but it's also like the dinosaur version of it. I mean, and it's going to cost you guys another $1 billion to get the newer version on there. So, yeah, I guess, just being more responsive. I mean, 20 million people are using e-cigarettes. There's even more. There's 30 million that are smoking in the States. It's going to be more than 34 products. It's going to be more than 56 products that actually really, meet the consumer demand of those adults. So I think, yeah, engaging more into that. And it seems also just the way the CTP was put up in itself with the TCA. Big, tobacco is bad. We got a demon in it. Even with the thing, they don't approve, tobacco products. They authorize them because if you approve it, it might be misleading. So it's like you already have a target on this. But again, it makes no sense when you're approving 662 combustible cigarettes in 2023, even though you saw a 14% reduction in adults smoking. So who is using these products? But they got to get their funding, so.
Yeah, I think the proliferation of flavored disposables in the U.S. is proof that consumers have switched and they are not going back. And even if the regulator takes the legal options away from them, they're going to find it. Like the market doesn't cease to exist simply because the supply chain changes, right? So I think the FDA should pay more attention to what's happening in the marketplace and use that as some sort of guidance in terms of how they're thinking about these products, because it simply cannot remain the case that we're sitting at like 100% rejection rate, right? 56 authorizations out of 27 million. That is not good stats, and we can't all be getting it wrong, So I think we would benefit from more, even if it's informal guidance, draft, just anything. Because that's a spectacular fail rate. And I've said this before, but like if 100% of the students in a school system were failing the tests, we would have questions about that school system.
We wouldn't give them more funding.
Would not give them more funding.
That's right. And I do think I don't know, I guess I'm being maybe naive, but not sure here, but last October when they had the open door session and went through the entire PMTA for 2 days when CTP opened it up to the public, I thought that was fantastic. Yeah. It was incredible, and it gave me hope. Again, might be naive, but hoping that continues, and it's not just a one and done, but that is where then consultants, researchers, manufacturers can come together and actually hear it from their mouth what their expectations are, and then have it on record and constantly refer back to that. That was super helpful. And now I guess that it's almost a year because we're coming up on October 24 and waiting for another one of those.
At that point, that's exactly what it's needed, more of that public access. And I think it gives the opportunity for industry to leverage that information to navigate innovation, but it is also the opportunity to ask questions, and they were willing to answer at that time. I'm always a proponent public meetings, joint sessions. I know that prior to COVID, there were several that were done, 2018, again, 2019, and then post-COVID as well this last year. There's a lot of information that came out, a lot of questions that were asked, and they stood around to answer all of those questions. And I think that's where that access is needed so that it doesn't seem like a black hole.
Yes.
And I also want to point out that I think you mentioned it, besides the standards and continuing to innovate, putting reduced risk products on the market, it's also the shift to sustainability focus on these products. I think the consumers want to see that as well, and that's something that I just wanted to add as well.
Thank you. They're going to play us off the stage in a minute.
Okay.
Did you have a question, Will?
Hi, Clive Bates, Counterfactual. Great discussion, really, really interesting. I think the danger, and you see it on the panel a bit, is the tension between promoting incremental improvements to a system that is fundamentally dysfunctional, and then having ideas for more fundamental change. Okay, and I think the former might inhibit the latter, and I think the fundamental change is the one that's necessary. Only 7% of the market is currently authorized. That means 93% is unauthorized. There's not much to be gained from trying to improve the process that led to the 7%. It's a much better idea to try and figure out why the 93% isn't authorized. And that's back to the innovation story. It's the fact that FDA can't produce the products that people want to buy, so they're buying them through illicit channels. And until that's fixed, the problem will persist, and it will always be, it will always be dysfunctional. There are products on the market that people use, like refillable products, for which there is no obvious pathway to market, given the way FDA, assesses the PMTAs. Okay, so I think, okay, there's a comparison with Europe. 300,000 products are in the European Union registry. Now, that might be too many, but surely there's some middle ground between 31 and 300,000, okay? So I think it would be good if the industry had both a set of incremental improvements that it would like to make, but also an agenda for fundamental change. And if I may, I think there are 3 fundamental changes that are needed. First, a much lighter touch screening process based on safety and marketing about the individual product itself, not its population impact. Secondly, comprehensive market surveillance, not done on a company by company or product by product basis, but by the FDA for the whole market. And then, following insights from that surveillance, post-market corrective action on any adverse population effects that are starting to emerge, rather than somehow trying to second-guess how successful or unsuccessful or adverse products will be once they're on the market, which literally no one could do, or they wouldn't be in the room, they'd be buying stocks and they'd be rich. So that's my 3-part agenda. I'd love to know what you think of that.
Please write my congressman.
Clive Bates for CTP director.
And Paige has got a,
Oh, sorry. Oh, Paige.
but I didn't want to interrupt if you have a response
thoughts
to
on that?
5.
I mean, there is always sort of a perennial discussion around blowing up the TCA and starting over again.
Yep.
That kind of terrifies me. I don't know. I don't
I
know
love
that we'd
the
end up
idea
with
of it.
something.
Get rid of it. If it's broken, don't try fixing it. It's broke. Get rid of
The
new
fear of
one.
what comes in its place.
I'm
different
scared
political
we'd end
place
up with a
and time.
worse regime.
Yeah.
But maybe I should be more optimistic. Sorry.
No, I think that there's a lot of truth in what you've just stated, and as well as that framework, how it would apply this, that's an implementation process. I do believe that if the agency made a decision on product categories or specific products in which they can go to a post-notification process or a screening process, as you mentioned, that could be something that they can evaluate, even within the framework that they have. I think that it doesn't need to necessarily be a blow-up of the TCA. It's just the implementation process, and this is something that they could make as a policy, and then create as they go. But I think it's currently they don't see it as they're treating all of the products the same, and understanding that there is a continuum of risk, and some products they not necessarily need to review as extensively as some other products. And so trusting that process is where it's needed. But you're absolutely right. I know we're about to get kicked off the stage, but.
That's all right.
Hi,
I think
everybody.
Paige
Hi, Paige.
Paige Magnus from Altria. I actually was going to go exactly where you went, Lillian, so maybe I'll just ask for a little yes or no from the panel. Do we believe that within the framework that Congress has established, within the TCA, FDA actually has the tools to do much of what Clive was suggesting?
Enforcement discretion, possibly. I feel
Yeah.
like they find a way to do it when they want
Yeah.
to. So really, it's just sort of a groundswell of support or engagement with the agency to hopefully get there. But I think I do
Maybe if they get user fees on e-cigarettes,
Yeah.
you know.
I do long for a blown-up TCA, but I also fear what would come in its place. So I think at least an attempt to get there with what we currently have, and certainly it's possible if there's a political willingness.
Couldn't also be tweaking the deeming regulations as well? Like when I don't think we need to blow up the TCA, but the deeming regulations itself seems that that's really where most of the rules and all of the rigmarole that's coming, that's causing, I guess, the lack of anybody being able to get through the PMTA process. It seems that that's from the deeming regs, not so much the actual Tobacco Control Act itself in that language.
But are we here? Are we where we are because of your point earlier, which was the PMTA is for pre-market products, and we found ourselves in a scenario where the products were already on the market, and so does it even need a shift at all? Because I think they being the regulator has been dealing with that issue, that they have had to review all of these applications because the products were already on the market, versus a scenario which I'm hoping is there's probably maybe 10, 20 applications that go in a year. That's a reasonable number for them to review and give the feedback in 180 days. And hopefully those 10, 20 products are the ones from responsible manufacturers. They're products consumers want. They've been tested at an individual product level. And so maybe after we get over this big hurdle that we've seen ourselves faced with, that it will transition and it will actually be utilized as intended.
My fear is that the complexity is actually a feature, not a bug of the Tobacco Control Act. But I see what you're saying.
Right.
Yeah.
Again, I tend to think glass half full.
Still have optimism. I agree.
Excellent.
All
Thank
right.
you all.
Is that the hook?
It looked like we had
Wrap
to
it
get on
up.
stage.
Yeah. Sorry. Well, the good news is Paige and Clive are going to be panelists later on in the week, and we can explore the entirety of this discussion a bit further. But unfortunately, we do have to move on. So I'd like to thank our incredible panel here today, helmed by Valerie Solomon with Jessica Zadidniak, Lillian Ortega, Laura Lee Euler, and the incomparable Lindsay Stroud. And I just want to add that it's really great to see a panel as well, and we had this at TMA this year, where we wanted to have an A-list panel, and it happened to be that everyone on the panel was female as well, because I think that speaks to the rising generation of leaders like yourselves in the industry that are moving up and that we're able to do this. So congratulations to all of us, but especially to you. Thank you so much. Thank you, everybody.